Sky News can reveal the federal government has granted millions in funding for cervical cancer awareness to an organisation accused of erasing women from its messaging. The opposition has attacked the move, saying it's not only offensive, but confusing. Senior reporter Caroline Marcus has this exclusive story.
It's the health campaign about a deadly disease for women that avoids the word women.
If you have a cervix, the test can save your life.
Concerns have been raised about more than $3 million in taxpayer funding being given to the group who made the video for another cervical cancer campaign. Liberal Senator Claire Chandler says language used by the organisation, like people with a cervix and front hole, is offensive.
Questions need to be asked about why government is paying taxpayer money hand over fist to this organisation to push their radical ideology that, quite frankly, is insulting to women.
More than 200 women die from cervical cancer in Australia every year. The government pledged last year Australia would become the first country to eliminate the disease. But Indigenous and migrant women are among the most at risk of contracting it. Health academic Carleen Gribble warns confusing language puts those groups at risk.
When language like anyone with a cervix is used, that's going to present a barrier to women who have lower English language skills, lower literacy.
We don't know what's going to be in the new campaign because ACON declined to speak to us. But according to its website, LGBTQ people are less likely to have cervical screening than the general population. Dr. Gribble says trans men, females who identify as men, are an at-risk group, but would be better served with campaigns targeted just to them.
If you try to meet the needs of different groups that are in, I guess, some conflict with one another in terms of what works best for them, you're going to meet no one's needs.
Non-gendered language in healthcare, like chest feeding and gestational carriers, has increasingly become a topic of hot debate.
What we really want to see from government, first of all, is a clear statement that this dehumanising, exclusive, horrible language that tries to erase what it means to be a woman is going to stop.
An equal amount of government funding has been granted to Aboriginal and multicultural organisations for their own cervical screening campaigns. Caroline Marcus, Sky News.